So there is like a separate project of me spending time with trans people and asking them questions about their everyday lives and experiences, and I've been thinking a lot about like medical providers, like anyone who's working within medicine experiences uncertainty. Like that is a given in medicine. So what is it about trans medicine that provokes so much like, you know? And I actually think that it's less about the evidence and more about how to interact with different people. And so, like if in your if in your training or in your life experience or in your lack of experience, uh, you have not interacted with a group a lot, it can feel like they are so different that they accidentally or sometimes intentionally become othered. So if we go back to like the scenario of the concern of we don't have great evidence about how if you take a medicine and you give it to one person and we have published results, but we don't know what happens when you give it to another person if they're on different kinds of medicine. I I think I think for trans folk in interviewing them, like at a baseline, what they describe is like, I'd rather have a medical provider just tell me, I don't know, but let's try to figure it out the best way we can. Like I think that that is a perfectly acceptable thing to say. Where it gets a little tricky is, and if other people have like, because I know that these studies are probably about to start coming out, but one of the challenges when it comes to scientific evidence is that there's a lot of proxy science happening. So let's go back to that gynecologist who's like, I know I work with estrogen all day long. And it's like, you do, but you do with cisgender women. And we don't always know. We can like use that data as a proxy for the likely risks in another person, such as a trans woman, but we don't always know, right? And I anticipate that that data is going to start coming out soon as more people start asking these questions. So yeah, is that yeah?
Anybody else in the room? I did check. We still have plenty of time.
Okay,
And I have a pretty big list of questions.
excellent.
Uh, Um, oh, you want to ask?
What would you like to see from the medical community as they assist with gender affirming care?
Mm. Um, I wait, as a sociologist or personally? Uh, maybe having a sense of humor sometimes. No. Um, I on the hard days where I was finishing up the book and like really trying to grapple with some of the more troubling quotes, I would go back to the more flexible providers. And it was almost like some people at the end of the day, they'll, I don't know, have a piece of chocolate or will go on a walk. Mine was going back to the quotes of like people who were describing, I think what we might call humility and compassion and kindness. Um, and so I think that those are attributes that a lot of different patients are looking for in their doctors. To have the humility to sometimes say, I don't know what happens if you are on this one medicine and this medicine, but let's try it out and keep a close eye on it. Because what often happens, I think, with trans people is instead it's like, we don't know what happens, so let's go ahead and figure out this other stuff before we get you on your hormones. And so delaying care and delaying care and delaying care like we do have evidence about that, and the mental health consequences are alarming. So I really think we need to stop thinking of like, let's get to the other stuff first before we get to the hormones. So, yeah.
Okay. I want to read this one just because it catches my eye when I'm looking at my list. You present the trope of the trans trickster and how that is informed and carried through in trans medicine and can still be seen in gatekeeping access to care for trans folks. Tell us more about that. How can we counteract that trope through how our systems operate?
Yeah, thank you for that question. For folks who haven't yet read the book, in part one, the historical part, I'm talking about a lot of these assumptions that started emerging during this time, and the trope of the trans trickster started coming up, where medical providers really thought that trans people would do everything they possibly could to lie and deceive their ways towards medical interventions. We do see it coming up. We see it coming up in, but I see it more so, I guess, in other realms of social life. I see the trans trickster coming up in all of the bathroom conversations, in all of the locker room conversations, in all of the ways where it's like there's a evil, mysterious trans, usually people conceptualize as a trans woman, like lurking in the bathroom, who's lying about their gender and will do anything they can to access fill in the blank. And so that is like that like sinister, you know, that originated in the 50s. And it actually like, I mean, it'd be interesting to, a lot of those providers are not around anymore, but to ask them like the potency of that trope, and it is carried forward for 70 years now. And it just keeps getting recycled in different social environments. Yeah.
Um, so what do you hope that readers will get out of this book? What do you want folks to take away? And what ways do you hope this information might affect how people engage with this topic?
I think it depends on the reader. Um, as I was polishing off the book and before I sent it out out to the editor, I was thinking about my brother. My brother, my brother has spent the last 20 years as a computer programmer. He's got two little kids, uh, has like a pretty status quo life, and we have a great relationship, and he's never quite understood what I do or who I am. And the day that he finished part one of the book, he picked up the phone and was enlivened and like raging. And he was like, wait, they used to tell trans people that you can't have kids? Like, what the F? Like my brother was able to pick up the book and get pissed off and wanted to do something. Um, that's a win. I also think that like the book might hopefully speak to medical providers in like sometimes, like a lot of my work, especially in interview spaces, I want to be really mindful and generous with the people that I'm meeting with. And so even if they're saying things that I'm like internally like ugh, like I don't want people to feel shamed. Um, so I'll say things like, oh, either can you share more about that? Or I'll say back to them what I think I've heard. And sometimes even just hearing back, like I have had gynecologists who are like, I just don't know what I'm doing. And I'm like, come on, you work with estrogen. I think you do. You do know how to work with hormones. You do it all day. But when I say it back to them, sometimes that's enough to like, it's like hearing someone else say it, I think catalyzes something for them. Like that's a win. So yeah, there's a lot of different audiences, I hope, and can pick up the book and get maybe something a little different based on, yeah.
Anybody else, or should I go one more from my list? Go ahead. Okay. Is that okay, Dr. Gu? We can, okay. You discuss the ways that other intersectional identities impact how trans people are treated and seen in medicine, and the idea that is carried on since the beginning of trans medicine in the US that the goal is for someone to be a passable, normal, and productive citizen. So can you talk about how non-binary, disabled, and/or brown and black trans folks are treated in the context of trans medicine and what additional barriers they faced?
Yeah. Um, so at the at the end of part one, I start like weaving together different historical legacies of uh, how uh, people in poverty are treated by the medical system and how people with disabilities are treated by the medical system and all of the misconceptions that are circling around these different communities are tethered to a similar legacy that we would refer to as eugenics. Um, and and the way of thinking about that is really like the creation of an idealized citizen, productive citizen, so-called productive citizen, and anyone who's not meeting that is subject to being punished by the state or medicine or the legal system or all of the intertwining. And so, in some ways, like when we start thinking about uh, trans people of color, trans folks with disabilities, uh, that the the surveillance over their bodies and bodily autonomy and I guess life chances becomes ever more restricted. Um, and so it's like, what is medicine's complicity in that? I mean, the figure of the ideal trans person was established on a very narrow, white, able-bodied, normatively gendered uh, person who could hold a job, person who once they transitioned would be perceived by the public as being in a heterosexual relationship, someone who wanted to disavow ever having children because they didn't want trans people to so-called pollute their children. And do we see how that plays out today? I think in some ways. Um, I think that when we listen, and I kept surgeons out of the book for the most part because they seem trained so differently and have such different considerations that it seemed like a separate group that I didn't know how to like cover all of the groups, all the things. Um, but when we listen to some surgeons talk about what is a so-called successful surgery when it comes to like feminization facial surgery, they're depicting once again, a white, thin, feminine trans woman. Like that is the success story still. So I think that like a lot of these ideas have carried forward. It's just difficult to acknowledge and talk about sometimes. So
Okay. Yeah, I'm okay with not going through. I have a huge list, so I don't think it's fair to like take to go through all of them. But is there anything else coming through online for questions? No more? Okay. So Dr. Dennis, does it?
Give Dr. Schuster another hand. Round of applause, please. Again, we thank you all so much for being here. And there are books. You have a few minutes. You could sign some books, and you are welcome to get your book signed. And so, wait, I forgot this. There's information on the table that you can learn more about what's happening to transgender youth and their families and the attack that's happening here in Michigan. And so please take some information if you're interested. Thank you
thank you
so
so
much.
much. Yep, thank you.